and the medication to have it so that you'll be able to perform your duties well. So the fees that are paid are very important, but there is no way we can raise it to $20 because from $5 to $20 would be difficult for people to comprehend, despite the fact that this is the cheapest anywhere in Africa. But the primary role is to make sure that healthcare is affordable to everyone. Sometimes even you will be surprised that the $5 they pay, some people say they don't have it. But they can spend $10 to go and buy Afra or buy something trivial. But what is more important is for us as a government to provide you with enough resources that will make sure that you are able to perform your functions and health care delivery to services to the people of the Gambia. So don't be worried about that. I think the resources are being provided. In fact, I think all the institutions that are here have contributed one way or the other to the purchase of this critical equipment. And what is important is that you don't wait until somebody comes to the hospital only to realize that you don't have an X-ray machine. When you realize that you're having problems with your X-ray machine, let us know so that remedial action can be taken immediately. But sometimes we used to, we go there and then say, what is going on? It's not working. It's not working? You only know when you go to the hospital. So now what we want you to do is, in fact, that was why I was obliged to send a team to make an assessment and look at your needs and prioritize them. And I think all the priority areas have the intervention of one or two of the parastatals here that have intervened to get you certain equipment. And this is what I want. You don't wait until there's nothing in the hospital and then somebody comes in, what is going on? Or an emergency, or somebody is sick and say we don't have this. Sometimes you'll be surprised that even oxygen would not be there. When I went to Taiwan, I personally bought oxygen plant for the RVTA. Also brought portable oxygen machines that were given to the RVTA. And these were supposed to last for a long time. But most of the things that are donated, if you have to make an investigation, some people will be in trouble. A lot of things have been donated to the hospital, and then they are nowhere to be seen. So it is really sometimes the management of the assets also brought to the hospital leaves much to be desired. For example, the machine for blood is it transfusion, hemodialysis machine. I personally thought they cost so much money. Well, to realize they don't even cost much. So when I went to Taiwan, I bought 10. 5 for the RVTH and 5 for the Biam Hospital. And later on also we bought more for Farafenye. Only for me to be told that Farafenye are claiming that they didn't get it. Tourists. So the hospital, I know the hospital as I know my hand. Well, it's a matter of concern because if you want this country to develop, you have to make sure that people are healthy. So for people to be healthy, all the health institutions that belong to government must function efficiently. I think you really have to put up a proper administrative structure. Who is responsible for what? So that if I come and say, okay, where's the hemodialysis machine that I sent to this hospital? Somebody will say it is here, or it has a problem, but it is replaced by this one. So that people will not take advantage of such lapses where anybody can change what he wants and there is no accountability. Do you understand what I'm saying? Yes. Thank you. You have our full support, so continue to do the work that you are doing.
Thank you very much, Your Excellency. Just a follow-up comment to what the CMD RVTH has mentioned. I think from my own experience at the National AIDS Secretariat, one area that needs to be looked at in relation to the RVTH is the management of the equipment, like we have highlighted. So at the level of the NAS, we have already provided funding under the RVTH and the University of the Gambia to train biomedical equipment technicians. And what we have realized is for even basic breakdown, we need to hire people from outside to come over. Just last week we paid for someone from Senegal to come over and repair the CD4 machines, and then you have to spend exorbitant amount on that. I think we've already started negotiations, and the training would soon kick off to train initially 6 people on biomedical equipment technicians, because it is the only way we can definitely ensure sustainability in terms of managing those equipment and things like that.
Thank you, Chairman. I would like to thank Your Excellency for organizing this important meeting. It is really a family meeting. So for me, I can say that I'm one of the happiest today, at least to have the opportunity to sit with the President. For our office, I think NGO affairs, yes, maybe our case is different from others present here. The reason being, although the portfolio of the office is on the OP, the budget is on the interior. So we encounter so many difficulties. So what I would like to appeal to you, sir, is as far as the office is on the OP, we would like our budget also to be on the OP, yes, so that things will be easier for us in the future.
Thank you very much. I think there's a problem. For some reason, Minister of Interior do not want to relinquish you to the office of the President. And you have 4 years now, I think. You're on the OP, but the Minister of Interior makes sure that you are in their budget. So, but I think the SG Secretary will take care of this, okay? But what is more important is the fact that since the budget is on the Minister of Interior, we will get you your money back. If anything you want, we will get it from the budget because it is already budgeted for. But we can work with finance and see whether that, in fact, that portion of the NGO affairs, the budget for the NGO affairs is transferred to the office of the President. Prioritize your programs based on the development aspirations of your institution, so that by next week, when you come here, you come with your areas of priority, and then you work together and see how we can guide each other to make sure that we put it into a proper perspective based on the resources available. You don't need to come and show us your budget, don't worry. All what we need to do is that these are the priority areas. But training should be given priority. As he said, this is the problem that most institutions